I'm James Stowe, Director of Aging and Adult Services at Mid-America Regional Council. As city employees, you interact with many residents, including some who are 60 or older or adults living with a disability. As frontline workers, or while performing other responsibilities you may have, you might have the opportunity to notice issues they have that are secondary to the main purpose for your interaction, and that may not be within your power to solve. For instance, a police officer, or maybe a building codes official, may see that a resident's house needs repair, or a Parks and Recreation employee might meet someone at risk for falling or has other health problems. Do you know how to help them? We can point you in the right direction to get them the help they need. Mid-America Regional Council, or MARC, is the area agency on aging for Cass, Clay, Jackson, Platte, and Ray counties in Missouri. AAAs, as these agencies are called, were established in 1973 by the federal government's Older Americans Act to deliver a broad range of services and support to residents in their service areas. MARC's Aging and Adult Services partners with community-based organizations, vendors, and other contractors to provide high-quality support services that enable adults 60 and older and their caregivers to lead healthy lives in their homes and communities. MARC's services cover a wide array of needs in the older adult community. Our services are funded through several sources, including directly from the Older Americans Act, along with Missouri Medicaid, grants, in-kind donations, and contracts with providers. Eligible clients do not have to pay for services, but are encouraged to donate when they're able. When you observe situations where older residents have a need for one or more of these services, you are uniquely positioned to offer MARC as a resource and referral to these residents. After a resident is referred to MARC, the resident, or a family member, or professional can call our information and referral line. A specialist will conduct a brief screening over the phone to determine eligibility, then send the information to a coordinator. If the client is eligible, an assessor or integrated care specialist visits the client in their home and conducts an in-person needs assessment. If approved, the client begins receiving services. If the needed services are directly funded through the Older Americans Act, the client must meet qualifications for the service, be reassessed annually to ensure they are still eligible, then services may be authorized for another year or until the service is no longer needed. The services that are funded through the Older Americans Act include home-delivered meals like Meals on Wheels, where clients receive hot meals or frozen meals delivered to their homes, group meals that are offered at community centers throughout the Kansas City region, transportation services that provide free rides to clients for a variety of purposes, and care management that links clients to a variety of services. Other services that are offered include a long-term care ombudsman program, where volunteers visit care facility residents and advocate for their needs, training, resources, support, and respite for those caring for older family members or friends, and the Veteran-Directed Care Program, which puts veterans in control of how their services are managed and delivered. We also provide home repair and modification services that can make an older adult or caregiver's home safer and more accessible. MARC also offers evidence-based health and wellness workshops that have been proven to help clients improve their physical and mental health, reduce pain, and help them manage their medical conditions and their healthcare experiences. In addition, MARC contracts with Missouri Medicaid to provide many of these services, and others, through their HCBS programs. As we said earlier, it's likely that you interact with older adults and veterans who could benefit from some of the services MARC offers. We hope that you will help us create pathways to help your residents access the services we can provide.
Our employees are out in the field and out in the community a lot. We love being able to refer our older citizens to MARC's Aging and Adult Services if they are in need of anything. And that can be anything from transportation, that can be home repairs, that can be food delivered to their home through their network of services. All of our staff can benefit from MARC's Aging and Adult Services, whether that be a police officer who sees something during a visit with a resident. It could be our water counter employees who are seeing something and when they're bill collecting.
Here are some ways you could make that happen. Your Parks and Recreation Department probably interacts with older adults who need health and wellness workshops, exercise programs, fall prevention classes, or other information that can make their lifestyles healthier. While police and fire personnel are obligated to report abuse or neglect, Members of your police force and fire department could also refer residents for home repair service, caregiver support, or for mental health issues. They can detect early signs of mental decline in aging residents and recognize inappropriate requests for services as a red flag for an underlying problem. Community development, public works, planning and zoning, departments and building codes enforcement personnel may find issues that our home repair and modification services can help with. In some cases, a home in disrepair can uncover other health or financial challenges that MARC's care management services can address.
When our code enforcement officer or our building inspector is at a home, we are, in many cases, inspecting from the built environment. So our city employee, our building inspector goes out, he's doing an inspection on a ramp, he hears the resident mention a need that they have that's greater than what he can do. He comes back and talks to us, and we make that referral back to MARC. It's through that partnership that MARC's able to help the resident, and we as employees are able to help our citizens.
Any frontline staff from your city, police officers, building code inspectors, receptionists, meter readers, clerks, anyone can become the conduit for an older adult to find needed services through MARC's care management services, if they look for the signs and know about the services we provide.
I would encourage any employee of any city here in the region to use these services. It is wonderful to be able to, when you come up on an issue, have a resource that has a wide variety of things they can do to help.
As city employees, being able to help our older residents is really important to us. So being able to do this through a partnership with MARC is important and incredibly helpful to everyone, and leaves us at the end of the day with a good feeling.
Contact us at the phone number or email address listed here.